Today's show is sponsored by strawberry.me. As nurses and future nurses, so much of what we do revolves around solving problems. So that when it comes time to focus that attention on ourselves, it can sometimes feel overwhelming. I've recently felt so overcommitted and like my days just spiral out of control. So I decided to try something new. I decided to try personal coaching with strawberry.me. It has been so incredibly eye-opening. My coach Anne asks me such great questions and helps me focus on what really matters. She's not telling me what I should do. She's helping me discover what is going to help me reach my goals. With Anne's help, I've set up consistent routines and daily habits that have made a huge difference in my overall well-being and help me feel like I'm finally back in control of my days. With strawberry.me, you're connected with a coach who's perfect for you, often in as little as 4 hours. And I love that Anne checks in with me periodically to see how I'm doing. It's a great motivator and reminder of the goals I've worked toward. Visit strawberry.me/nursemo. That's strawberry.me/nursemo and take charge of your future with the help of a certified coach. And get a $50 credit when you sign up at strawberry.me/nursemo. Something funny that my mom used to say to me growing up was that I had champagne taste on a beer budget. But come on, who doesn't love the good things in life? The thing is, sometimes those luxury items can often be outside my budget. Yes, my mom was right. But that was until I discovered Quince. Quince is now my go-to for luxury essentials at affordable prices. Priced at 50 to 80% less than similar brands, Quince has a little bit of everything. 100% Mongolian cashmere sweaters starting at just $50, washable silk tops and dresses, and even 14-karat gold jewelry. Everything I've purchased from Quince so far has been absolutely divine. I have a beautiful navy blue boat neck cashmere sweater that I wear with absolutely everything. And I recently purchased a chic leather tote that fits all my work essentials. And let me tell you, these items look and feel so much more expensive than they actually were. Give yourself the luxury you deserve with Quince. Go to quince.com/nursemo for free shipping on your order and 365-day returns. That's QUINCE.com/nursemo to get free shipping and 365-day returns. Quince.com/nursemo. Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast where I teach concepts and share tips on how to thrive in school and at the bedside. Welcome back to Mo's Monday Minute, where I share a quick tip that can help you improve your nursing practice or your student nursing practice right away. And today's tip is about assessing your patient with a spinal block. And a big question that you will have for your patients who have received a spinal block for a surgery, such as a knee surgery, is this spinal block resolving? And this is going to be a key part of your post-op assessments. And what you are determining with this post-spinal block assessment is you want to determine the level at which your patient is able to detect pain. And by level, we're talking about how far up the leg or the body they are able to detect pain. And the most accurate way to do this is by touching the patient with something cold. And for this, I like to use ice that I put inside a glove. That way the patient doesn't get all wet and I can just go to the back, make a quick little ice pack with the glove and use that for a number of assessments. And the reason we want to use cold is because the nerve fibers for temperature and pain are affected similarly by local anesthetics. So if the patient is unable to feel cold at the site of the surgery, well, this is a good indicator that they're not feeling pain in that area either. You want to, again, use ice to assess this and correlate that with the dermatome level for a really accurate post-spinal assessment. Now, some other things to assess to determine if the spinal block is resolving is if the patient can move. Obviously, you're going to be asking them to wiggle their toes, move their ankles, bend their knee, all of those things, because it's very, very important that you not get the patient out of bed until they are able to actually move their lower extremities. And you hope that they can feel something as well, because if you can imagine, walking on feet that you can't feel would be really, really dangerous and put you at high risk for falls. And we certainly don't want that for our patients. So I hope this helps you with your post-spinal block assessments on your surgical patients. See you again soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.